Well, some startling new research suggests a rise in unemployment related to the pandemic could lead to a dramatic increase in suicides. Dr. Roger McIntyre is a professor of psychiatry and pharmacology at the University of Toronto. He's also the study's lead author. Good to have you with us this morning.
It's nice to be with you. Thank you for covering this important topic.
Yeah, let me share some of these findings with our viewers. Your team found between the year 2000 and 2018 an increase of 1% in unemployment, generally correlated to 1% increase in the suicide rate. So does this suggest a direct relationship between these two?
It certainly suggests a direct association. The context is difficult to get your mind around in the sense that in the last 2 months, 3 months, we've seen 15 years of job growth in Canada and the United States erased in such a short period of time. You know that our unemployment rate in this country now is approaching 14%, similar to our U.S. colleagues. And this percentage, this what I call 1% rule, has been replicated during the previous recession. So think about the trajectory that's occurred only in the last 3 months and the implication that has for mental health. But here's an important point I really want to emphasize. Unemployment does not cause suicide. It's highly correlated with suicide. And of all the macroeconomic factors we have to work with, it's the most powerful factor associated with suicide. So this is not just a viral pandemic. This is a mental health crisis. And both of those crises have to be given equal weight.
I also want to lay out a couple of scenarios that your team looked at, 3 in particular. A mild increase in unemployment would lead to about a 1% increase in suicides over the next 2 years. A moderate increase would lead to 5.5% increase in suicides, and an extreme increase leads to a nearly 28% increase in suicide. Which of these scenarios is most likely to play out given what we know about the pandemic and job rate so far?
Well, let me start off with what I hope. I hope all those scenarios are wrong. I hope we don't see any increase in suicide. But here's what I can say. The answer to your question will depend. It's going to depend on how long this lasts. For example, the Society of Actuaries in the United States has just recently published, it's not just the target unemployment, it's how long it lasts. For example, if it lasts for 1 year to 2 years, we're going to see a doubling of the rate of depression in society. Depression is the condition most often associated with suicide. The other factor in there is the opportunity. We talk about flattening curves. Let's prevent this curve. The opportunity is that we can get people back to work, get small business up and going, of course, respecting public health recommendations, and also continue with psychiatric first aid for those who need it and social programs for those, in fact, who meet eligibility. We can really mitigate this. So none of these percentages are a fait accompli, a done deal, but they will, in fact, be realistic unless we get ahead of this curve.
What do we need to see then to mitigate the potential increase in suicide risk? What can we do to help? And as you say, stop the curve before it starts.
The most important thing is recognition of this. You know, I've heard, and we've all heard about how important it is for us to protect our physical health. And that's, of course, true. The World Health Organization says you've got to protect your physical health and your mental health and your social health. In fact, that's how we define health. So what this really translates into is what the World Bank calls smart containment. We need to get Canadians who want to work back to work. They've got to work because work is a resiliency enhancer. It's a vaccine for mental health, is how I refer to it as. We need to, in fact, make sure people have the financial security, which, of course, is afforded by having a job. It's afforded by being able to work. And there are many, many Canadians suffering. For example, you would know, Amber, that the Canadian Mortgage and Housing Corporation is now saying that 20% of Canadians are going to require forbearance on their mortgage. Canadians are in distress. Back to work, and where eligible, where appropriate, we need to have the wage subsidies. I'm very pleased to see the federal government doing that. And the provision, again, going back to this point, of psychiatric services. And this is one of the hopes I have for Canadians, is this disaster we've gone through for 3 months. I hope it really forces a rethink on our mental health system and provides timely access to good psychiatric services. They work, they're effective, they treat the conditions people are suffering from. That's required. But before we get there, let's build the resiliency through some of these activities, which includes getting back to work.
Dr. McIntyre, it is a fascinating angle to this story. So glad you were here with us and authored this study so that we could talk about it today with Canadians. Thanks so much.
Thanks for having me this morning.
And just a note to our viewers, if you or someone you know is in crisis, we ask you to reach out, call 911. For more information on some of the mental health resources available, you can visit the Canadian Mental Health Association at cmha.ca. We will also be posting a link on our social media channels. Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.